Despite its harmless-sounding name, Goofball is a dangerous new drug trend, with users injecting both methamphetamine and heroin that's quickly becoming popular off the tails of the opioid epidemic.
This combination is very dangerous because these highly addictive drugs mask each other's symptoms and can be fatal. According to reports from the DEA, they've seen 118% increase in meth seizures by law enforcement between 2010 and 2017.
Here in the Valley, a mother and daughter have a warning and a message of hope.
You wonder, if they're okay, if they're eating, if they're sleeping, if someone's hurting them, what clothes are they wearing?
Jennifer Prickett has seen her daughter hit rock bottom. She gets emotional when she recounts what drug addiction has done to her 24-year-old daughter, PERIE.
Losing my daughter to drug use over that 14 years or 12 years has been very hard on myself and my husband.
PERIE Prickett says her drug use has left more than just emotional scars.
So I started using drugs when I was about 12 years old, got into heroin at a young age of 14, and really struggled with that for the last 10 years. I'm 24 now.
But PERIE says she's determined to stay clean this time. She's currently enrolled in an intensive outpatient program based here at the Scottsdale Recovery Center, where PERIE is recovering from alcohol and drug abuse, including heroin and meth, a combination known as Goofball.
Basically work on the dopamine receptors, and so it releases, you get a huge dump of dopamine, and dopamine is what they call the feel-good gene, or the feel-good neurotransmitter.
I would actually go to school withdrawing from heroin and meth, and that was one of the harder things I've had to deal with. It made it so I couldn't go to school. I didn't get to graduate high school because of it.
A lot of people, they do report that they call it the roller coaster, and that it'll go up and down, up and down. Most of the times, because of the counseling effect, it does allow the user to use more heroin than anticipated or than wanting to. This often leads into overdose situations.
According to a study published in the Drug and Alcohol Dependence Journal, more and more opioid users nationwide now use meth, with a 34% increase in 2017, with the greatest increases being reflected in the western part of the country.
I've had a lot of struggles. I've been homeless for the last year or so, and it's been very difficult for my family as well as myself. And I really just wanted to make a change because I knew I wouldn't survive much longer if it continued.
Just not having my daughter with me for all the fun things that we could do together as a mom and daughter.
I was just broken down so mentally, emotionally, spiritually, and the biggest thing I can say is there are people that love you. There's people that want to help you and want to see you succeed. And no matter how hard you think this is, you can do it.
Those who suffer from polydrug addiction need help healing from two separate disorders at the same time, making the road to recovery full of challenges and at times setbacks. PERIE is now 51 days sober and is looking forward to continuing on her path to a new start with the support of her family, friends, and physicians.